This voiceover is going to address modalities and different pathologies that we won't cover during the rest of the semester. Typically when we talk about modalities in the sports medicine area, we won't talk about different pathological conditions such as myofascial syndrome or osteoarthritis or other conditions that we don't typically see in sports medicine. So today I'm just going to give you kind of a general overview of a few pathologies and which modalities that you would want to use or would not want to use. So at the top of your notes page it says certain modalities may be contraindicated, which means they should not be used based on a patient's stage of healing, application over a specific body area or organ, or because of an unrelated medical condition. The evaluation is the time when you will gain most of this knowledge, but any contraindications must be identified prior to the initiation of treatment. So the following on your notes is a list of pathological conditions that you might encounter and want to utilize modalities as part of the treatment plan. Remember that it is the moral and ethical necessity to consult the athlete's physician regarding the diagnosis and treatment of a pathological condition. However, I do need to note that I have a few times in practice had a physician write a note for a particular modality that was actually contraindicated because of a pathology. So don't depend on physicians to know all the contraindications for the use of ultrasound or heat or diathermy. You will be responsible for knowing those. In your notes I have a little smiley face, a sad face, and then a precaution. So the smiley face in your notes is where we're going to list all the modalities that are safe to utilize, or otherwise known as green light modalities. The sad face is contraindicated modalities, also called red light modalities. You would not use these. And precautions are modalities that you have to be attentive as to what's going on, and if there's any negative response, you need to stop the modality immediately, and that's called a yellow light modality. The first one that we're going to discuss is really not that common, but I have come across it a couple times in practice, and it's called complex regional pain syndrome, abbreviated CRPS. It's a symptom complex that is characterized by pain that's disproportionate to the injury. So somebody might have an injury and they're recovering from it. So this might have been an ankle sprain, let's say. And this is not a typical response for an ankle sprain. The person might become hypersensitive to touch. They have excessive edema, redness, and muscle guarding. If left untreated, it can become a permanent disability. And obviously cause more functional problems. It can occur post-injury or post-surgery, or be delayed a few weeks from either of those. So for our happy face, modalities that you can use, if we consider prayer a modality, which I would, because it is a tool we can use to decrease symptoms. We put prayer there, and then whatever they can tolerate. Typically this will be electric stim, gentle massage, and perhaps gentle joint mobilizations. Modalities that are not tolerated very well by somebody that's experiencing complex regional pain syndrome are all the cold modalities: ice pack, ice bath, ice massage. Precautions would be moist heat. They might respond well to using the packs from the hydrocollator. And then also precaution is moderate massage. Depends on if they have pain, it might just be too much for them to tolerate. The next one is myofascial pain syndrome. This is a complex grouping of symptoms that emanates from muscles and connective tissue. It's often found in the lumbar and cervical spine, but it can be in the extremities. It's characterized by taut, tender bands of soft tissue and a pattern of bilateral trigger points. And those are displayed on this picture. So they have bilateral trigger points in these areas frequently. There's no single known cause, but several factors seem to be involved that can trigger this response, and usually not just one of these. They include posture, poor posture, increased stress, fatigue, trauma, muscle length and strength imbalances, an illness, deconditioning. Again, usually it's regional but not focal. So there might be a whole upper right quadrant region of pain and symptoms, but not a really isolated, localized point. And that would be all. So if somebody is experiencing or has been diagnosed with myofascial pain syndrome, modalities that are often helpful are superficial heat, so those would be hot packs, and gentle manual therapies. Specifically, there's a massage technique called myofascial release. We'll review this during the massage section of our class. Ultrasound is usually tolerated very well, and electric stim. When I say electric stim, I'm abbreviating that. It's electrical stimulation is what I'm meaning. Modalities that are not tolerated very well: aggressive massage and most cryotherapies. Again, cryo meaning cold. Osteoarthritis, it's a chronic disease involving inflammation of the joints, especially weight-bearing joints, characterized by destruction of articular cartilage, overgrowth of bone, and bone spur formation. Modalities that are helpful, again, we include prayer. Heat usually feels much better than cold, so heat is a good modality to use. And mild traction. However, if the person has a diagnosis of rheumatoid arthritis, we will not use traction. Modalities that are contraindicated include cold, and that's simply because it usually makes the symptoms worse, joints become more painful. This is why you see a lot of older people that have osteoarthritis will move to southern states because of the climate. Percussion modalities include diathermy, which is a deep heat, and ultrasound, which we would characterize as a local deep heat as well. The next one on your notes is cancer, and what I've done here is listed signs and symptoms that should raise alarm if you hear several of these, or even a few, and should result in a consult or referral to a physician for follow-up. So you can read through those. You need to memorize these. You need to be aware of them. Probably if I heard one, I don't know that I would be necessarily that alarmed. If I saw a few of these, for example, if somebody had night pain, unexplained night pain, and a fever, it's low-grade fever that had been going on for a few days, I would call a physician and ask them to get this patient back in for a workup and follow-up. So know those signs and symptoms so that you know who to refer immediately back to a physician. Modalities utilized with people with cancer, this is under the smiley face prayer, and this really is a case-by-case situation. You need to consult the physician. If we're working with somebody that's been diagnosed with breast cancer and we're treating an ankle, it may be okay to use modality to treat their ankle. Again, it's going to be based on location, and then always consult a physician and get the verbal order that it is okay to use a modality. For contraindicated, there are a few strictly contraindicated modalities. One is deep heat, because it could promote metastasis or growth of the cancerous cells. This would include ultrasound and diathermy. Electrical stim is usually stated as a contraindication, as well as heat or cold modalities over a malignant tumor, or even benign. I wouldn't put it over a tumor. All right, the next one is diabetes. Diabetes is a disease that affects the insulin secretion and or action, resulting in elevated blood glucose levels. This occasionally can, but not always, result in what we call a neuropathy of peripheral nerves. So peripheral nerves would be the nerves in the fingers and the toes, and they have difficulty sensing pressure, heat, cold, in the correct way. For modalities with somebody with diabetes, if they have this diagnosis, we don't have any modalities that we use to treat it or that are good for it, so I don't really have anything under the smiley face other than prayer. Under precautions, we can use ice modalities to the hands and feet, but we have to be careful, probably limited time, checking them frequently. Also, superficial heat is a precaution, and ultrasound at a continuous wave is precautioned. Under the contraindications, it is contraindicated to use local heat to a site that was recently injected with insulin, because it can change the timing and distribution of the insulin. So somebody, maybe they just did, usually they aren't putting insulin in their hands and feet, but in their midsection. So it's usually not an issue, but we wouldn't put maybe a ice or a hot pack on somebody that had just injected in the abdomen and they had maybe an abdominal strain. It would be kind of a weird situation, but we wouldn't use heat right after they injected insulin. Next one is multiple sclerosis, and MS is a disease affecting the central nervous system in which the white matter becomes inflamed and then demyelinated. The affected areas then become scarred over. People typically have exacerbations and remissions of the symptoms of this. Common signs and symptoms are abnormal vision, difficulty with balance, poor coordination, strength loss, or spasticity. Modalities that are helpful, prayer, occasionally ultrasound can be used for spasticity maybe. And then there's something called cooling suits, and so if you can drop their temperature down, that's often helpful. Modalities that are not good to utilize would be heat, hot packs, warm whirlpools. A localized ultrasound would be okay, but when you have bigger areas, hot packs, basically whirlpools, diathermy is another one that we wouldn't use. Also, electric stim that causes a continuous muscle contraction. And you'll understand that more when we get into e-stim, but we can set the machine so it's continually contracting a muscle, and that can easily over-fatigue a muscle of somebody that has MS. Moving on to cerebral palsy, they're very different levels and grades, so this again is pretty general. But cerebral palsy is a non-genetic, not progressive, non-communicable neuromuscular disorder of posture and voluntary movements. The cause is generally due to ischemia of the brain, so depending on how long the brain was without oxygen will indicate to some level the involvement or disability. Person may have tendencies towards hypertonicity, as you can see in this boy's wrist flexors and knee flexors and hip flexors. Or he may have hypotonicity. They don't have a great picture of that, but they become very flaccid, just really kind of floppy. Somebody has cerebral palsy. Some of the modalities that are more frequently used might be ultrasound and superficial heat. Most modalities are really okay and not contraindicated with somebody that has cerebral palsy. We just have to be careful of making sure that we aren't putting a modality or particular modalities over implants. So when we talk about individual modalities, we'll talk about some that shouldn't be used over implants, and somebody with a cerebral palsy may be more likely to have an implant in their legs, or typically their legs or ankles. All right, venous thrombosis, which is the formation of a blood clot in a vein. Common signs and symptoms are localized redness, increased temperature, and pain. If you suspect somebody has a venous thrombosis, the thing that you need to do is immediately refer them to the ER, because we don't know when this might dislodge, right, and travel to a site that it becomes life-threatening. So they should have somebody drive them to the hospital. They shouldn't drive themselves. If it's, say, in the calf, that's a common location, and they should avoid moving their leg as much as possible. So under the happy face, we have prayer and immediate referral to ER. Things that you absolutely should not do and can significantly worsen this, or anything that might dislodge this clot. So it would be massage, intermittent compression, electric stim, ultrasound, diathermy. Those are the 5 that are the main ones: massage, electric stim, intermittent compression, ultrasound, and diathermy. All right. Oops, this one didn't come. This picture didn't come out, but I had one in there. Peripheral vascular disease. It's an imprecise term that indicates disease of arteries and veins of the extremities, and it results in an inadequate blood flow. So wounds don't heal. We get poor circulation that can lead to severe necrosis or death of extremities due to inadequate blood flow. Because of inadequate blood flow, we also have decreased sensation. So we don't really have any modalities that we use to treat this. We don't have any good modalities that'd be helpful other than prayer, always the best modality. Of negative or contraindicated modalities would be actually most of them. However, the biggest ones are intermittent compression and diathermy. I do have a section here, precaution. Sometimes we might use superficial heat, might use ice packs. The book talks about, or not this book, but other references talk about maybe using electric stim and gentle massage with precaution, but boy, that would be a pretty rare case, I think. Usually we're not doing a lot of treatment with somebody with peripheral vascular disease as far as modalities. Moving on, if somebody has a pacemaker, which is an electrical device that substitutes for a defective natural pacemaker to control the rhythm of beats of the heart. So up here on the left side, there might be a small little incision, looks like that, where they've implanted a pacemaker. There are no modalities that we want to use around pacemaker. There are some contraindicated ones, though. Contraindicated ones would be diathermy, which is deep heat, electric stim, obviously it can disrupt the electrical current, and ultrasound right over this area. Cellulitis. Picture of cellulitis, it's a little more severe. Here's another picture around the quad, a little bit of cellulitis. But it's inflammation of connective tissue. Usually there's been some sort of infection or an injury. There are no modalities that we would say, yes, we want to use unless it's a mild cryotherapy, but pretty mild, and prayer. Contraindicated is massage and heat. That can make cellulitis much worse. The rest of your notes here, I have just two non-pathological conditions that I want to mention. Obviously, pregnancy is not pathological. But we typically will not use any modalities in the low back area. But especially we won't use diathermy, ultrasound, or lumbar traction. The rest of the modalities are precautioned. I've used ice in the low back. Could use some heat, gentle superficial heat in the low back. And then I'd add an E-stim also to the low back or abdomen of someone that's pregnant. And then somebody, I put aged down here. I don't have a particular age in mind, but just knowing that as we get older, the skin begins to thin a little bit, and so it's more difficult to tolerate extreme heat and cold. So those would be contraindicated, extreme heat and cold. So be sure to review the pathologies, and those will come up in our case studies towards the end of the semester, but you want to keep this in mind as we're going through each modality. Thanks.